So good afternoon. I'm very pleased to be here today with the Lieutenant Governor and with Carolyn Kirk, who's the Executive Director of the Mass Tech Collaborative, and with UMass Lowell Chancellor Maloney and with City Manager Donahue. Take a look at some of the work that UMass Lowell has been doing in response to COVID-19 and especially their work with our MERT program. But first, before I discuss this, I do want to give an update, as I do every day, on testing cases and hospitalizations. Yesterday, we saw another day of numbers that were heading in the right direction. We've had several days in a row now of promising results as we've entered phase one. Massachusetts is continuing to ramp up our testing capabilities. We're well over 500,000 tests performed to date, which makes us a national leader. The average positive test rate continues to inch down to about 8.5% as we continue to see hospitalization totals decrease as well. This is coming as we start slowly to get back to work, and those are both positive signs. But what it also means is that people have been playing their part. They've been washing their hands, covering their faces when out in public, distancing themselves from others when they can, and everyone is staying vigilant with respect to symptoms. The science, as we all know, and this is clear, doing these things is how we stop and kill the virus, and we all have to keep it up. It's great to be back here at the Fabric Discovery Center. I want to thank Chancellor Maloney for your extensive partnership on this center and so much more. You've heard us say many times that it's a constant battle to get personal protective equipment, so-called PPE, in the door and to support our frontline healthcare workers and protect patients from COVID-19. And while we continue to work a variety of supply chains, we've also looked to our own businesses right here in the Commonwealth to help us produce life-saving gear and supplies. And through some unique partnerships, we've created and funded a program to assist local manufacturers to make their own PPE, even if it's not in their traditional business model. The MERT team has been working in collaboration with the Command Center to help Massachusetts manufacturers change their operations and quickly start producing much-needed products. Since launching, we've heard from over 750 manufacturers worldwide who are looking to help, and nearly 450 of those companies were located here in the Commonwealth. MERT's helped those companies identify what types of items are most in need, provided regulatory guidance, helped coordinate supply chain needs and access to testing products, and reviewed product instructions for use, labeling, and packaging. Going forward, it's important that we continue to quality control and test the products we're making using the same benchmarks and standards that others use. Product testing is why we're here today at the Fabric Discovery Center at UMass Lowell. And I just think it's important to point out at this point, the Lieutenant Governor and I have been in this space on a number of occasions over the course of the past 5 years or so. And I think, honestly, I think this floor was nothing but a bunch of pillars. I'm looking at Chancellor Chen, right? The first time we came here. And that was because it was part of a joint initiative between the federal government, the Commonwealth of Massachusetts, and the U.S. Fabric and Manufacturing Association to create, for all intents and purposes, this Fabric Discovery Center here. And there is a lot of really interesting work that goes on in this place, and there has been for the past 5 years. But there is something kind of special about the fact that work that we did with UMass Lowell, with local manufacturers, with the federal government, and with a variety of other folks to stand up a Fabric Discovery Center here has made it possible for this operation, which already knows a lot about making fabrics of one kind or another, to stand up a set of testing operations that can then be used to test masks and test gowns and test other elements that are so critically part of the PPE supply chain. And it just continues to build on this idea that the more we can do from beginning to end here in the Commonwealth of Massachusetts, including testing, a lot of the fabrics and the products are being developed here in Massachusetts, the less we have to worry about some of the issues that come with getting involved in global supply chains, which, Lieutenant Governor, I could go on for hours about how much fun that is. The academic institutions and the R&D institutions have been critical to much of the Massachusetts-made PPE production effort, and that includes teams from MIT, WPI, and of course the folks here at UMass Lowell. For N95 respirators, surgical masks, and gowns, Merck's partners now have capabilities to test for a number of very specific factors here to make sure these products work as well as they're supposed to. Merck's coordinated access to this PPE testing, which has served the needs of over 80 companies at this point, including the State Department of Public Health and the Massachusetts Emergency Management Agency. We've also benefited from the world-class R&D centers that Massachusetts calls home, including the Advanced Functional Fabrics of America operation, which I believe has, they got people right here. Yes, Chancellor? Okay. And their CEO, Dr. Sasha Stolyarov, is also here today. There he is. Thanks again for the partnership on so many of these initiatives. Here at UMass Lowell, these folks have conducted 80 tests of filtration efficiency, 82 tests of liquid barrier penetration, and 27 tests on gowns. I asked if they had actually tested any of the Merrow gowns, which is one of the enterprises down in Fall River that's famous for making industrial sewing machines, but is now in the business of making about 500,000 gowns a week. And I was told that while they haven't actually tested any of Merrow's gowns yet, I'm sure they will at some point. We're going to suggest they do. They actually do have a bunch of Merrow sewing machines that are actually part of the operation here, because this is, of course, a fabric discovery center, and they do make the #1 industrial sewing machine in the world. Just a nice little Merrimack Valley, South Coast story. And obviously with the new equipment that we just saw as part of this tour, they'll be able to increase their capacity here substantially. The Fabric Discovery Center was able to purchase this equipment to test PPE through a grant from the MERT program that enables high-volume screening of a myriad of materials for N95s, gowns, surgical masks, and other products. And without this kind of testing, it would take a lot longer to produce quality PPE here in Massachusetts and get it tested. Carolyn was saying earlier that as the volume of this sort of material, these kinds of products has become more and more critical to first responders and to our healthcare community, obviously the backup associated with finding places and spaces where you can get the test done started to grow. In some cases you could do it here, but it took a long time because of the backlog. Some of you had to send out of state. Once again, you know, building your own capacity just makes it better, faster, cleaner, and more efficient, and way more customer-centric and service-friendly. And this is in many ways a great example of a pivot that's going to work in the short and the long run for everybody. There are companies also all over the state, from 99 Degrees Custom and New Balance in Lawrence, to Caroline Products in Danvers, to Boyd Technologies in Pittsfield, that have already taken advantage of the testing capabilities here. 27 companies are making face shields, masks, N95s, test swabs, and medical gowns, as well as parts for ventilators because of the work of the MERT. And many of those products and materials are tested right here through the Fabric Discovery Center and their partners. Aside from PPE, there are other important initiatives underway here to support the fight against COVID-19 for our residents and potentially for other states. The Massachusetts Medical Device Development Center, known more colloquially as M2D2, works with some of Massachusetts' smallest medical device companies and serves as a biotech incubator to give companies access to researchers and resources at UMass Lowell and UMass Medical School. M2D2 is helping with research to support a universal flu vaccine for the biotech company Versatope, and that includes technology for a possible COVID-19 vaccine. They're also working on simple blood tests to detect COVID-19 through more rapid testing for nucleus probe technologies. I think we all know that those blood tests over time could end up being an incredibly important tool for surveillance, especially as we go forward. And we're hopeful that that work will yield good results so we can forge ahead to offer more testing and treatment options to our residents and to others. Finally, I also want to applaud all the volunteers, both students and university personnel, who are working in the fashion masker space. Where'd she go? There she is. who are here and supplying face coverings. These are made with donated materials and distributed to members of the community like the Boys and Girls Club, the homeless shelters, and others. And on behalf of the Commonwealth, please know that we're very grateful to you and to all of the manufacturers for the role you're all playing. We've worked hard to make progress over the last few months, and we'll continue to do so in partnership with many of the people across the state who have come together to step up and fight COVID-19. That, of course, is no surprise to any of us who know anything about the quality of the ingenuity, imagination, and creativity of the people of Massachusetts. And with that, I will turn it over to our partner here, Chancellor Maloney.
Thank you so much, Governor Baker, and also to you, Lieutenant Governor. And listening to the Governor talk about the great history that we have in partnership in building out this facility, it's no surprise to see the great work that is being done. Know how grateful we all are for, I know I speak on behalf of City Manager Eileen Donahue, who's just been a great partner with me in going through this crisis, and our state delegation, Reddy Mom representing our state delegation, how grateful this community is for your ongoing support. You're always here for the city of Lowell and for us at UMass Lowell, so again, please accept our gratitude. I also welcome Emily Byrne, who's here on behalf of Congresswoman Lori Trahan, and we thank the Congresswoman for her great work that she is doing on behalf of us all. We need that help and support that she's fighting for. And of course to Carolyn Kirk of Mass Technology. Thank you. You were the first one to reach out to UMass Lowell with the governor. We're so grateful to be invited to MERT, this partnership. And I would like to also acknowledge Julie Chen, our Vice Chancellor for Research, who really spearheaded the efforts that the governor was talking about. You know, just a few words about UMass Lowell. You know that as a university, we take great pride in the kind of partnerships that we work really hard to develop with business and industry and community organizations, as the governor said, partnering with federal and state government to make sure that we position our communities and our business and industry to serve the Commonwealth and the nation in the best way possible and to adapt to this ever-changing economy. It's something that we believe is one of our greatest strengths and something that sets us apart as a university. So of course, we're so proud when it was this very strength that enabled us to pivot on a dime as the COVID crisis came into place, and the governor turned to UMass Lowell for help, and this community turned to us for help. And we immediately started to allocate and send all of the PPE equipment that we had, as well as this manufacturing of it, working again with MEMA, the city and local hospitals. The Lieutenant Governor was there when we opened a surge hospital right here at UMass Lowell in our recreation center. And of course, most recently, redirecting all of our research efforts, these brilliant faculty, scientists, and engineers working hand in glove with industry, and now with this great support from MERT to bring about the kind of testing that the governor referred to earlier. It is with great pride that I acknowledge this incredible team that stepped to the plate from the beginning, working 24/7 to contribute to the solutions. Through this initiative, through MERT, we've been able to provide material testing capabilities, allowing manufacturers to triage underperforming materials. And the governor and the lieutenant governor had a chance to see some of that great work just a minute ago. Already 400 samples, including respirators, surgical masks, medical gowns, have been tested for entities such as Brigham and Women Hospital, MEMA, and companies like New Balance, Access Technologies, Warwick Mills, Caroline, MassCore, and others. And it's our privilege to work with them to find new ways and improved ways and accelerated, most importantly, accelerated ways of getting this testing done. This all happened right here at this Fabric Discovery Center, and as the governor said, this would not be here without their support. They were here when we did the ribbon cutting, it seems like yesterday, and we celebrated this great partnership that we have. And so to be able to do this work right now really is important to us to be able to make those contributions. And here in our Mass Medical Device Development Center, we are one of 5 technology hubs designated by the National Institute of Health to assist in the rapid acceleration of diagnostics initiative to help speed technology for COVID testing. It's our greatest hope that all of these efforts combined will help us to fight this pandemic and bring it to a close. We know that's a long way away, but we know that the work together, and we want to reassure you, Governor, again, we thank you for your confidence in UMass Lowell and this community, and know that we are here standing in partnership with you to help bring this virus under control. Thank you for all you do, both of you, to the entire administration for your great leadership. Know that we, the Commonwealth, are forever grateful. Thank you.
Tip of the hat to you, Carolyn, on this. But once again, Mert, you know.
It's memorable.
It is memorable. You're right about that. Okay. Steve, I think the floor is yours.
I have a question on another matter in terms of the marathon near Boston today.
Yeah.
There's no marathon. Your reaction to that big disappointment?
Well, obviously, the marathon in Massachusetts and in Boston is an iconic event, and it's almost like a rite of spring, along with opening day at Fenway. And I know it was incredibly disappointing for the runners and for a lot of the folks who are involved in setting it up and making it happen, that it wasn't going to happen this spring. And I think people had hoped at the time that it would be possible to reschedule it in the fall and pull it off then. But I think we've all concluded that, and I know this is not the answer anybody would want to hear, that for the time being, we are better off being careful and cautious when it comes to really big events like that. And I know there were conversations about how to possibly reconfigure the race, and I personally think that in the end, the city and the BAA made the right decision by erring on the side of caution. But I'm sure everybody's hoping and anticipating that a typical rite of spring here in the Commonwealth, which is the running of a marathon, right around opening day and the celebration of Patriots Day, will be back with us next spring.
Is this a precursor of other things, Fenway Park, Red Sox, Patriots coming up in the fall that you might not see?
Well, I certainly know that there are ongoing conversations between Major League Baseball and the teams and the Players Association about how they might configure a season, and we've certainly been informed about those conversations as they've gone on. They still have work to do to figure that out, but I think all of us are going to try to be as reasonably accommodating as we can be. I do believe that in the end, whatever happens with respect to playing baseball, it's going to start without fans. Yeah.
Governor, I think it's nursing homes. When you look at the dashboard for number of cases at nursing homes, the state is reporting it in ranges. For example, 10 to 30 cases at this. Why isn't the state reporting the exact number of cases at nursing homes?
I think we actually did today.
Up until now.
Yeah, well, some of them, look, first of all, the work that's been done over the course of the past 60 days, which is how long we've been at this, to create a thorough and comprehensive data pack for the people who are actually working these issues, as well as the public generally, has been an effort that the Commonwealth has put tremendous work into, and by almost every measure is considered to be as good as anybody in the country in terms of making comprehensive data on a very detailed and accurate basis available to people every day. And there have been a number of areas where we started with what I would describe was kind of a baseline, and then worked over the course of the past couple of months to make that baseline more and more precise and more readily available as we got better at collecting a lot of this information. And I certainly think that the nursing home story generally, there's an article in the New York Times today that said that if you had to pick a sport that would be absolutely perfect with respect to COVID's ability to infiltrate it and make it miserable, you would pick basketball. And the reason I read that story is because I'm a basketball player, and I agree. But if you had to pick a care delivery model that was absolutely perfect for COVID-19 to wreak havoc on it, and it has across the world and across the country, you would pick a model where people who serve those folks every day put their hands on them a lot. They feed them, and they bathe them, and they dress them, and they recreate them, and they transport them. And then to top it all off, I'd make it a virus that, in the beginning, everybody thought had a couple of days of sort of asymptomatic gestation, but that everybody eventually got it. So everybody started with taking everybody's temperature on their way in the door as the way of judging and measuring whether or not people were healthy. And then, of course, it turned out over the course of maybe a month or so, people started saying, we think there's asymptomatic conditions here that are permanent with respect to some of the people who got it. And now we're to the point where a lot of the research is indicating that perhaps as many as 25 to 30%, maybe even more, of the people who contract this virus and shed it never show any signs or any symptoms in the first place. And that in many ways has a lot to do with the tragedy associated with long-term care here and in other places. We've made adjustments all the way along, not just in data, but also in our approach to supporting the industry, the people who work in it, and the residents. And this last move, which was a comprehensive audit of the entire industry, and we were one of the first states in the nation to actually start testing residents and staff on a go-forward basis. We required that every resident and every staff member get tested in this latest round. And in addition to that, created a very comprehensive infection control program that everybody had to pass and adopt. And I do believe those measures have had some impact on the fact that we've seen the positive test rate in the nursing homes go down, and we've also seen a decline in the death rates. But this one for all of us has been terribly difficult, an enormous tragedy, and something where we have continued to build our data pack as we've gotten smarter about how to collect data and make it available. And as I said before, by almost any measure, Massachusetts' database is as good as any you're going to find anywhere in the country.
Following up on the testing and the BPH report, experts say that while baseline testing can be helpful, what long-term care facilities really need is a targeted surveillance testing program that involves serology. Does the state have any plans to help coordinate and fund that?
I'm not familiar with the report, but our approach going forward with respect to testing relative to long-term care facilities includes both PRC and serology testing. Yeah.
Last
Will
question.
fund it?
Yeah.
So I want to ask you a little bit about the unemployment benefits and the fraud claims that were disclosed. So a lot of, obviously, people rely on unemployment benefits because of the pandemic. So what steps is the DUA taking to weed out additional fraudulent claims, and when do people who need the checks expect to have those benefits restored?
Well, there were about 150,000 claims, I think, that we ran through a third-party data check over the past couple of days, and I think somewhere in the vicinity of 145,000 of those claims passed and have been paid. The others are being put through a series of second and third level reviews to determine if, in fact, they're legit. Part of the reason for making the announcement on this was, A, to make sure people knew if they didn't get their check today and they got it on Saturday or Monday or something like that, that it's more of for most people it's actually a deposit, so it can happen any day. That there was a reason for it, and that they shouldn't be alarmed that if they had duly filed and were legitimately eligible for the benefit, they would get it. But I also think it's critically important for us to do, once we get news and knowledge from federal authorities and others that there's a large nationwide scam going on here, we need to do everything we can as quickly as we can to make sure that we're not paying money out to criminals, and that we're paying money out to people who are in fact legitimately eligible for the benefit. And we have to balance to the best of our ability, the opportunity to collect data, run it out against other sources to determine if in fact these people are real, and then for the ones who aren't, act accordingly, and then make sure we get the benefits out to the ones that are. But on the 150,000 that we put on hold, the vast majority of those went out once we ran the test and determined they were in fact legit.
Thanks, guys.
Real quick, any comment on the murder of George Floyd?
So I guess what I would say is that there are only two real emotions I think most people can draw from that. One is outrage and the other is dismay. Never should have happened, and I'm glad that the federal government's investigating it, and I expect and anticipate that the state of Minnesota will too, and they should.
Thank you.